Assalamu alaikum, dear KMD members. So I'm from Team B, and the topic of my presentation today is Endodontic Complexity Assessment. And under the able guidance of Dr. Shair and Shiraz, I'm just presenting this topic. Basically, my take on this topic is only from a GDP point of view, as I'm no specialist. So if at all there is any mistakes, please correct me. I'm just looking forward to learning more. So basically, for this topic, which it's basically these guidelines. There are two set of guidelines which have been given for you to to aid a dentist basically to treat an endodontic case. Okay, so these guidelines are available, right away. Just it's an American anesthesiologist available straight away on Google. But basically, let's just analyze these guidelines based on three cases. Okay, so say for example, on a Saturday morning, you have a case patient, 56-year-old, medically healthy, fit and well, and he's presenting with pain that is well localized to an anterior tooth. Okay, the patient in this case basically is not anxious and he has no limitation in mouth opening. Okay, and also there's no difficulty in obtaining his literally the radiograph. Okay, so we have taken a radiograph and the IOPA is here. Okay, now let's just analyze this radiograph. So this is an IOPAR and this is the tooth in question wherein the patient has got well localized pain. Okay, so if you look at this, the root morphology is basically there's no curvature of the root morphology. Okay, and the pulp space, there are no pulp stones or anything like that. It's minimally restored. Okay, and the canal is patent all throughout the entire length, and the axis is quite straight. So this is a minimal difficult case. Okay, now let's just consider a moderately difficult case. Now here the patient, again healthy, non-anxious, no limitation in mouth opening. He is reporting of pain that is well localized to mandibular second premolar. Okay, now here if you see, basically the pulse space is fine, just a bit reduced over here, but something important for us to consider is that the tooth is crowned. He's got a porcelain fused to metal crown. Now, the risk is that the porcelain can fracture during access preparation, and the orientation of the crown, it actually may differ significantly from that of the root. Okay, so that is why this case has been categorized as a moderately difficult case. Okay, then we have a case 3, which is a highly difficult, considered as one of the difficult case, because now the tooth in question is a mandibular second premolar over here. Okay, so basically there is a full coverage crown. Okay, that is not in the alignment in this moderately inclined root. Okay, the canal is visible, but actually if you see the size of the canal, it is reduced in size. It is visible though. Okay, and in addition to that, you see there is a cervical restoration over here, an amalgam restoration basically. Okay, and because of this, there's a restoration, there is a risk of removing excess dentine. Okay, and also there is a risk of perforation during access. So obviously there could be a chance, there could be a blockage, okay, during the canal instrumentation. So this is considered as a difficult case. Another example of a difficult case is wherein there is a highly S-shaped canal, okay, which is wherein if you consider the root axis, this is a straight axis. If it is up to 15 degrees, then we consider it as a simple case. 15 to 40, moderately difficult. Anything beyond 40 degrees angulation of the root to the long axis is considered as a highly difficult case. Now, so when you get a case, so we have considered three cases which are minimally difficult, moderately difficult, and extreme highly difficult. So how are you going to assess a patient? So basically, whenever you have an endo case, you need to analyze the case as a whole. Firstly, check his medical history. What ASA class does he belong to? Is it fairly simple to have him anesthetized? Okay, has he had any problems before? Okay, does the patient look compliant? Is he anxious? How is the mouth opening? Is there any limitation? Make sure there's at least 2 finger space between the upper and the lower jaw for you to able instrumentation. Is the patient able to take radiographs? I mean, is there any gag reflex? So what is the condition, that emergency condition, that is he coming to you? Is there a big swelling, huge swelling? Is there severe pain? So then definitely think about high difficulty. Apart from that, so firstly, whenever you look at the radiographic difficulty, when you measure, always first, okay, analyze with the crown. See, look at the crown. Okay, is there any restoration? Okay, look at the pulp chamber space. Okay, are there any pulp stones? Okay, look at the canal size. Firstly, the root axis, tooth angulation, and then the canal size. Is it reduced in size? Look at the periapical lesion. Is it more than 6 millimeters? And it's highly difficult. Then you also look into the periodontal support of the tooth. Is there enough periodontal support for the tooth? Would the tooth become mobile? Are there any fractures, any horizontal fractures, any vertical fractures? Is there any crack in the tooth? Because any crack in the tooth can actually cause any periodontal problems. Is there any any other periodontal pathology? So perioendo lesions. Is the tooth retreated? If it is retreated, any surgery has been done at the root tip, any episectomy that has been done at the root tip, then definitely poor prognosis. These are all the factors to consider which makes it more difficult. So the canal morphology, root morphology. Also look at the history. Why has the patient come? Has there been any history of trauma? And if there is a trauma, if the root is fractured, if the tooth is fractured, has it been just an enamel dentine fracture, or is it a complicated fracture? And if at all if at all there is any luxation, subluxation, then definitely there would be different treatment options for the same. So there are so many things to consider, and also check for resorption externally. Is there any resorption? If there is resorption just at the tip, then it is a moderately difficult case. But if it is beyond externally and much more wider in distribution, then definitely it is a difficult case. So these are the main things that you would consider while analyzing a case. Not just that, look which tooth are you treating. Is it an anterior? Is it a posterior? Up to premolars, it is considered as minimal difficulty, and beyond premolars, up to first molar, it is moderate difficulty, and if it is second and third molar, there is a particular angulation to the arch, which is why it is considered as highly difficult. Okay, so these are all the things you need to keep in mind whenever you consider a case. So all in all, take home messages. So make sure whenever you are attempting an endodontic treatment, look at the patient as a whole, include his medical condition, look at the tooth, root, the mouth, the ease of access, the patient compliance, and make an honest decision and evaluate your skills as well as the difficulty of the case, and then make sure you keep the patient's best interest in mind and go ahead. So I hope these are a few things that would certainly help the budding dentist, probably more so, but not the veterans of endodontist already here. But this is what I have understood from the topic. Please correct me if I'm wrong. Thanks again. Jazakallah.